Hey guys, Jim here. Welcome back to our Echocardiography Registry review. Let's keep rocking this test. Question 76. What does this 3D video demonstrate? A. Vegetation. B. Flail mitral valve. C. Mitral valve prolapse. Or D. Rheumatic mitral valve. The answer is B. Flail mitral valve. Question 77. What type of pathology is shown here? A. Amyloidosis cardiomyopathy. B. Non-compaction cardiomyopathy. C. Dilated cardiomyopathy. Or D. Apical hypertrophic cardiomyopathy. The answer is A. Amyloidosis cardiomyopathy. Question 78. Which of the following is associated with this disease? A. Dilated cardiomyopathy. B. Elevated preload. C. Decreased afterload. Or D. Hypertrophic cardiomyopathy. This disease represents severe aortic stenosis. Hypertrophic cardiomyopathy is associated with AS. Question 79. Which of the following is being evaluated here? A. Pulmonary vein. B. Left atrial appendage. C. Hepatic vein. Or D. Aortic valve. The answer is B. Left atrial appendage. Question 80. An M-mode ratio greater than 1.3 to 1 indicates what? A. Asymmetric hypertrophic cardiomyopathy. B. Dilated cardiomyopathy. C. Eccentric hypertrophic cardiomyopathy. Or D. Concentric hypertrophic cardiomyopathy. The answer is A. Asymmetric hypertrophic cardiomyopathy. Question 81. Click on the left upper pulmonary vein. So where on this image would you click the left upper pulmonary vein? Sometimes I'll ask questions like this where the picture will be zoomed in so much to the point where you can't tell where you're at or what you're looking at. The best way to figure out these type of questions is look at the rest of the anatomy and see if you can identify something that looks familiar. For instance, this is probably the left atrial appendage here. And if that's the case, then the left upper pulmonary vein is going to be right here. So we'll click that and move on. Question 82. What does an M-mode ratio less than 1.5 to 1 indicate? A, asymmetric hypertrophic cardiomyopathy. B, dilated cardiomyopathy. C, pathological remodeling. Or D, concentric cardiomyopathy. The answer is C, pathological remodeling. Question 83. You are called into the emergency room for a stat echocardiogram. When you arrive, 3 more stat exams are ordered. Which of the following do you scan first? A, patient with fever suspected of having a vegetation. B, patient with severe chest pain suspected of having wall motion abnormalities. C, patient showing signs of heart failure. Or D, patient suspected of having cardiac tamponade. The answer is D, patient suspected of having cardiac tamponade. After you finish scanning the patient with tamponade, the order of importance is as follows. You'll scan the patient with severe chest pain, followed by the patient with a fever. Then you'll scan the patient showing signs of heart failure. Question 84. Drag and drop the letter X on the aorta. So where would you put this X indicating the aorta? The answer is right here. This is the aorta. So you'll just grab this X and place it about right there is fine. Question 85. Click on the left upper pulmonary vein. Right away, I know this is the left atrial appendage, so the left upper pulmonary vein is going to be right here. Question 86. What type of artifact is this? A, refraction. B, mirror image. C, grading lobe. Or D, side lobe. The answer is side lobe. Question 87. What type of artifact is this? A, ring down. B, enhancement. C, comet tail. Or D, shadowing. The answer is D, shadowing. Question 88. What is the hand pointing to? A, dilated coronary sinus. B, thoracic aorta. C, cardiac cyst. Or D, artifact. The answer is B, thoracic aorta. Normally the aorta will be down here, but this patient has a tortuous thoracic aorta. And a way you can rule out a coronary sinus is the coronary sinus usually lies around this area. Question 89. Which of the following is being evaluated on this transesophageal exam here? A, tricuspid regurgitation, B, mitral regurgitation, C, aortic regurgitation, or D, aortic stenosis? The answer is D, aortic stenosis. Question 90. How many pulmonary vein cycles are there? A4, B3, C1, or D2? The answer is A4. Question 91. During diastole, the tricuspid annulus moves in what direction? A, anteriorly, B, superiorly, C, inferiorly, or D, posteriorly? The answer is B, superiorly. Question 92. This hepatic waveform above the baseline occurs when? A, atrial diastole, B, ventricular systole, C, atrial systole, or D, early ventricular diastole? The answer is C, atrial systole. Question 93. Which of the following causes the ventricular septum to flatten in diastole and become round in systole? A, right ventricular pressure overload, B, right ventricular volume overload, C, right ventricular pressure and volume overload, or D, constrictive pericarditis? The answer is B, right ventricular volume overload. Question 94. Which of the following is apical hypertrophy associated with? A, Marfan syndrome, B, Ehlers-Danlos syndrome, C, Yamaguchi syndrome, or D, Schoen syndrome? The answer is C, Yamaguchi syndrome. Question 95. Which of the following suggests severe aortic regurgitation? A, effective regurgitant orifice area of 0.2 centimeters squared. B, pressure half time of 299 milliseconds. C, holodiastolic abdominal aortic flow reversal. Or D, vena contracta of 5 millimeters? The answer is C, holodiastolic abdominal aortic flow reversal. Question 96. Which of the following causes the basal interventricular septum to briefly shift posteriorly or leftward in early diastole? A, severe aortic stenosis, B, severe mitral regurgitation, C, severe mitral valve stenosis, or D, severe aortic regurgitation? The answer is C, severe mitral valve stenosis. Question 97. Which of the following is known as apical ballooning with systolic dyskinetic movement of the left ventricle caused by coronary artery vasospasm? A, apical myocardial infarction. B, pseudoaneurysm. C, apical aneurysmal ischemia. Or D, Takotsubo. The answer is D, Takotsubo, or Takotsubo cardiomyopathy, aka stress cardiomyopathy. Question 98. Which view can show the right and left coronary arteries? A, apical forechamber with posterior angulation. B, short axis at the aortic level with inferior angulation. C, two-chamber with posterior angulation. Or D, apical five-chamber with cranial angulation. The answer is D, apical five-chamber with cranial angulation. Question 99. What does this echocardiogram demonstrate? A, dilated cardiomyopathy. B, apical hypertrophic cardiomyopathy. C, non-compaction cardiomyopathy. Or D, amyloid cardiomyopathy. The answer is C, non-compaction cardiomyopathy. Question 100. What type of tumor will grow alongside the IVC? A, rhabdomyosarcoma. B, leiomyosarcoma. C, hemangioma. Or D, angiosarcoma. The answer is B, leiomyosarcoma. Which of the following suggests severe mitral stenosis? A, deceleration time of 150 milliseconds. B, pressure half time of 220 milliseconds. C, EA ratio of 3. Or D, end diastolic gradient of 10 millimeters of mercury. The answer is B, a pressure half time of 220 milliseconds. An end diastolic gradient of 10 millimeters of mercury is moderate to severe stenosis. Anything greater than 10 is severe mitral stenosis. The mitral valve will remain closed unless fluid and pressure in the left atrium increases above the pressure of the left ventricle, forcing the valve to open. What is this called? A, conservation of energy. B, conservation of mass. C, inertia. Or D, Starling law. The answer is C, inertia. This image was recorded when on this patient with a normal IVC. A, inspiration, B, expiration, C, Valsalva, or D, cessation of breathing. The answer is B, expiration. What does this echocardiogram show? A, persistent left superior vena cava, B, large pleural effusion, C, large pericardial effusion, or C, aortic aneurysm. The answer is A, persistent left superior vena cava. This dark area represents a dilated coronary sinus, and there is a pericardial effusion, but it's probably more small than large. Which of the following causes the ventricular septum to flatten in diastole and systole? A, right ventricular pressure overload, B, right ventricular volume overload, C, tamponade, or D, constrictive pericarditis. The answer is A, right ventricular pressure overload. What are the arrows pointing to? A, L wave, B, E wave, C, A wave, or D, AR wave? The answer is A, L wave. Which of the following will overestimate the disease in this video clip? A, large atrial septal defect, B, severe aortic regurgitation, C, severe aortic stenosis, or D, low pulse wave and continuous wave Doppler gain settings. The answer is C, severe aortic stenosis. What occurs during diastole? And select 2. Ventricles contract, AV valves are open, atrial systole, semilunar valves are open. In diastole, you have atrial systole, and you have the AV valves are open. When performing TDI, the cursor will be placed where in relation to the mitral annulus? A, parallel, B, perpendicular, C, intersecting, or D, angled? The answer is B, perpendicular. What occurs during the T wave on the EKG? And select 2. Ventricles contract, AV valves are open, atrial systole, Semilunar valves are open. The answers are semilunar valves are open and ventricles contract. Click on the pericardial effusion. The answer is right in this region here. It extends from here all the way to here. This tool can calculate all of the following except A, LV volume, B, systolic function, C, strain, or D, diastolic function. The answer is D, diastolic function. The S wave on the hepatic vein waveform occurs when? A, when the semilunar valves are open, B, when the AV valves are open, C, ventricular diastole, or D, when the AV annulus moves superiorly. The answer is A, when the semilunar valves are open. And that concludes all the questions for this video. I will hurry and write 25 more questions and upload that video as fast as I can. If any of you have any questions about your upcoming echo boards, feel free to email me at ultrasoundboardreview@gmail.com, or you can personally text or call at 435-922-1635. If any of you need any echocardiography tutoring, feel free to sign up for our class. It's called Echocardiography Tutoring on our website, ultrasoundboardreview.com. I will personally teach you everything you need to know for your echocardiography boards. I'm Jim with ultrasoundboardreview.com. Thank you so much for watching.